For over 160 years, YWCA has been on a mission to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. For all. That means women and girls, people of color, victims of domestic and sexual violence, for survivors and fighters and builders of all kinds. A tall order, right? Not with your help. As our nation nurses the deep wounds of racial injustice and the COVID-19 pandemic rages on, YWCA's work has never been more urgent. Women have been hit hard by lost jobs, lost wages, and lost childcare. Girls are missing school time while their families struggle with financial uncertainty, and communities of color are struggling under the weight of COVID-19's disparate impact on their health and the devastation of racial injustice. At YWCA, we hear their voices every day. We work directly with real people living real lives. We know the crises facing our nation right now are enormous, but together, we have the power to make a difference, to pass legislation and establish policies that give communities the resources to rebuild so that women and girls can thrive. Yes, together, because none of us can go it alone. With your help, we can bolster childcare and early learning programs for working mothers. We can protect survivors of violence of all kinds. We can build economic security, fair workplaces, racial equity, and mental health support for women and families in need. With your help, we can mend the pieces of our fractured nation. Sit with us. Let's talk about the path forward. Let's rebuild together.
Good afternoon. My name is Alicia Rose, and I serve as the interim CEO of the YWCA USA. I want to thank you for joining us today, and I also want to thank you for all of your work and your commitment to eliminating racism and empowering women. As we gather here today to kick off YWCA's annual Stand Against Racism campaign, I must say I join you today with a heavy heart at a very profound moment for our nation. Even as the George Floyd's murder trial continued over the last 2 weeks, we sat anxiously and we awaited the verdict for Devin Chauvin. And in that moment in time, we saw 11 Black people die. We saw Dante Wright die a day or two before. We saw Ma'Khia Bryant die at the hands of a police officer 30 minutes before the verdict was read. And we also saw Andrew Brown died the night the verdict was read. A month ago, 8 Asian Pacific Islanders died at the hands of a reckless shooter in Atlanta. I am sad. I am heartbroken. I am hurting. I'm tired. I am exhausted. I'm tired because as a Black woman and as a mother, I am in fear constantly. I'm tired because these senseless murders of our Black and Brown communities continue to happen at the hands of the police, at the hands of white supremacists. I'm tired of reckoning, and I know that I am in the right place with the right people. I know this because I am here with you. I know this because I've been a part of the YWCA movement for 15 years. And for the 162 years of YWCA, we have been at the forefront of the most pressing issues. I'm optimistic because I know that the YWCA will continue to show up, stand for communities of color, stand for the women and girls that need us the most, stand for our all marginalized communities to make sure that everything that we go through as communities, that we're supported, we're heard, and that we move towards resolution. It is enough reckoning. There needs to be change. We need to move from reckoning to change, to resolution. And I know that your presence here with us is an indication of your exhaustion of all of the things that we go through as a country And I haven't even started to talk about the pandemic. I haven't even started talking about addressing racism as a public health crisis, what has brought us here today. I have not started to talk about the disproportionate cases of African Americans, people of color, indigenous, Asian communities that continue to face the disadvantage of accessing health care in this country. I've not started to talk about how the COVID pandemic has continued to further disenfranchise the communities that were already disenfranchised. I've not started to talk about the she session. I've not started to talk about the unemployment rates that continue to skyrocket, impacting the most vulnerable communities that need us the most. All within a time period where we had to deal with a divisive election, an insurrection, and so many other pandemics. Our communities need us. We thank you for being here with us. We thank you for standing with the YWCA. We thank you for standing with our communities. And as we continue in the optimism of a better tomorrow, as we continue with the optimism that we will move forward the work that our ancestors started, I want you to continue to join us, because right now we need each other to make the change that is real, that will last, that will move communities of color from surviving to thriving. We need to do it together, collectively, locked arms, determined, and focused. To do the work that we do for our communities, we need a supportive community. We need each and every single one of you. So I want to thank you again for joining us. I want to leave some space and some grace for the trauma and the re-traumatizing that we've all had to go through during this week or two of Chauvin's trial. I want to leave some space for the grieving of the families that continue to lose their babies, their mothers, their brothers, their friends at the senseless hands and killing of police and also of other members of the community. Women of color today continue to be marginalized. Last week, we joined together to raise awareness for maternal health. Today, we are here again today, not only to raise awareness for racism being a public health crisis, but to drive towards solution. And to do that, we have an extraordinary panel. I can spend time going through the statistics, but I'm not going to do that because I want to make sure that we give our panelists the time to help us drive towards resolutions. I am so very proud of our YWCAs in Wisconsin, Ohio, Pennsylvania, Texas, and beyond for paving the way, for declaring racism a public health crisis, for doing the work, for leading the charge, for rolling up their sleeves, and not only making sure that it is declared a public health crisis, because that is only the beginning, but making sure that they led the way to seek the resolution needed for a better tomorrow. YWCA is in the business of resolutions. Enough reckoning. Enough reckoning. I want to thank you for joining us. And at this moment in time, I would like to introduce to you Senator Sherrod Brown from the great state of Ohio. He continues to champion so many policies that would lead us to the change and the resolution that we seek. Since joining the Senate in 2007, Senator Brown has been championing the rights of middle-class families, and he has fought to ensure the dignity of work for everyone, and that is what equality and equity means. Everyone, regardless of the color of your skin. As chair of the Senate Banking Committee, Senator Brown continues to advocate for affordable housing and anti-discrimination initiatives that are particularly critical to women of color and survivors of domestic violence. He also leads with his powerful voice on many other committees. He's been outspoken. He's been a friend to the movement. He's been a champion to the movement before COVID, during COVID, and we are so grateful for his voice and his partnership. Senator Brown, the floor is yours.
Thank you so much, Ms. Rhodes, for your, thank you so much for your inspiring words and your kind words in the introduction, but especially your inspiring words about what's happening in this country. I am so grateful. You mentioned the committee, the Banking, Housing, Urban Affairs Committee. We did the first hearing in Senate history to examine structural racism in housing. We know that from black codes to Jim Crow to redlining to the Trump administration locking in discriminatory housing practices and regulations, that we will never have opportunity broadly for people in this country as long as we have this kind of wealth inequality and this kind of home ownership, gaps in home ownership, and this kind of structural racism in housing. So thank you for your efforts there as a YWCA. Thank you for also the supporting my legislation in declaring racism as a public health crisis. Many of my communities, YWCAs in Ohio, I see Margaret Mitchell on the screen of the Cleveland YWCA. Thank you for your efforts, and all over my state, more and more communities, in large part because of the push of the YW and the work you do. So thank you. I also appreciate sharing the podium with Representative Judy Chu, who has been a real leader in Congress in a relatively short career so far there from California. And also Dr. Wen, whom I knew from her Planned Parenthood days and since. And thanks for your work on public health. She is a terrific spokesperson when I see her on television and other places. So thanks for that. Also, I need to call out one other longtime friend of mine, a longer time friend of my mother's, Janine Donaldson, who Margaret knows. Janine Donaldson runs the Elyria, Ohio YWCA. And the reason I wanted to do this speech, and I don't know if I begged you to let me speak or you, I don't know how this worked, but my mother credits her, my mother's most important organization by far in her life was the YWCA. She was president of the Mansfield YW. She was president of the Ohio YWCA. It's why I have the views I have. She grew up in a little town in Georgia, 500 people. She met my dad at the Mayflower Hotel when he came back from World War II. He was from Mansfield, Ohio, and this little Southern girl who always cared about racial justice moved to Ohio, had 3 children. I'm the youngest, and she always talked until her death at 88, 10 years ago. She talked about how exciting it was one day when she was head of the YW. She got to drive to Cleveland and pick up Shirley Chisholm at the airport and spend like 3 hours there and back in the car with Shirley Chisholm. And she talked about that and talked about that and talked about that. And it was just great. But my mom said something that I would like to repeat, especially for African Americans in this audience, especially if you grew up in the South. My mom would tell me, you remember in the late 60s, early 70s, I was in high school. And there was all the quote unquote controversy about busing for school integration, right? And my mom said, when I was growing up in this little town in Georgia, in segregated Georgia, I remember school busing. It's when they used to, in old rickety buses, bus little black kids Black children past the new white school to the inferior Black school. That's what school busing was. That's what busing was in those days in the segregated South. And my mom always took those lessons and taught me, and that's why I introduced bills like the declaring racism a public health crisis, and why I wrote the child tax credit, which will reduce child poverty, overall child poverty, Black, white, Native American, overall child poverty, Latino, by over 40% in this country. And it's really how Joe Biden and the new Senate majority and Speaker Pelosi and Judy Chu and all are moving this country forward in big ways. So thank you for allowing me to speak today. I want to talk for a moment. I can't say as well as Ms. Rhodes just did about Minnesota and what happened in Columbus. And what's happened in Columbus, as Ms. Mitchell knows, even though she's in Cleveland, and we know what happened to Tamir Rice in Cleveland. We know what's happened just this week. We know what's happened 2 other times this year in Columbus. And as Ms. Rhodes said, it's just happening with far too much frequency. And as my friend Joyce Beatty, Congressman from Columbus, said, this has to be a catalyst for change for our country. We just can't move forward as a country the way we should with this number of police killings. We know who's disproportionately dying in the hands of police. We know who disproportionately dies of this virus. We know that African Americans are less likely to have access to life-saving vaccines. It's the same people who are discriminated against and targeted while simply going about their lives. This pandemic in so many ways has taught the rest of America what you already knew as YWCA activists. Has taught the rest of America. It's been the great revealer and exposed what you already know, that racism in public health, racism in public safety, racism in education, racism. People on this call were more likely to die in childbirth than my mother or my wife. You were more likely to have babies that died before their first birthday, just because of your race. Then even if you're higher income and higher education, you're still more likely, as you know, of your counterparts, of people that look like me. We see this in disparities in access to health insurance and health providers. We see the implicit biases in our healthcare system. I'll never remember some years ago, I think it was in Cleveland, President Mitchell, I was sitting around the table with 7 or 8 African-American women. And they were a couple of them were low income, a couple of them were doctors or lawyers. I mean, they were a good broad cross section of the community. And I just kind of sat there and said nothing, because that's when I perform best, when I listen. And I just remember they're talking among themselves, knowing I was there, but mostly talking among themselves about healthcare and about being a Black woman in this society in the 21st century. This would have been maybe 6 or 8 years ago. And we all need those eye-opening experiences to understand better. We know this resolution won't solve centuries of racism, this acknowledgement, nor will the hearings we did in banking housing about structural racism in housing solve but it's as we craft this resolution, I held these roundtables around Ohio, including within ACP chapters, groups of young African Americans of both genders, listening to Latino organizations, listening to Asian Americans talk about these healthcare disparities. So your work on this is exemplary and so important. I know you won't let up. You don't need this guy from Cleveland, Ohio to tell you not to let up, but thank you all for doing that. And I'll close with this. Every year, we did this last week, I convene 6 other senators. I choose 3 Republicans and 3 Democrats. Raphael Warnock joined us this year, as did the new senator from California, Senator Padilla. This week, I bring 7 of us come to the floor. As I said, 3 Republicans, 3 Democrats, and we read Dr. King's letter from the Birmingham jail. And if I can't imagine a YWCA activist has not ever read that letter, but I'm guessing that some of you haven't read that letter in the last couple or 3 years. And I exhort you to read it again. You may remember the story that Dr. King was jailed for civil disobedience, as he was many, many times. And you may remember that the white ministers in Birmingham and throughout the South, from Atlanta to New Orleans to Dallas to Charlotte, white ministers were saying, Dr. King, the white moderates, not the right-wing white ministers, but the white moderates were saying, Dr. King, we agree with you. We believe everybody should have the right to vote. We're for equality. We're for non-discrimination in housing and employment and the judicial system. But don't move too fast, Dr. King. We've got to slow down. We've got to do this in the right time. And Dr. King, his letter from Birmingham jail really pushed back and talked about the urgency of now. So, but I always save, if I can be selfish for a moment, I always save one part of the letter for me to get to read, because it's my favorite Dr. King quote, because it exhorts his activism. And Dr. King said in this letter, progress never rolls in on wheels of inevitability. Progress never rolls in on wheels of inevitability. And King knew that, Dr. King knew that. Dr. King's activism is why we move this country forward, his activism with millions of others. But it's something I always will remember, that progress never rolls in on wheels of inevitability. It rolls in because Ms. Rhodes and Ms. Mitchell and my friend Ms. Donaldson and all of you, Dr. Nguyen, all of you fight to make this, to bring progress to this country. So thank you for just one of the great organizations in our country's history, the Young Women's Christian Association. I'm so proud to get to speak to you nationally, and please continue your fight and call on me for any ways that we can work together. Thank you very much, Ms. Rhodes.
Thank you so much, Senator Brown. I know you said that we didn't need you to tell us to continue the work, and as you have been a part of the work for oh so long, that we will absolutely continue the work, but we cannot do it without you. We cannot do it without your support. So I want to thank you again for taking the time out of your schedule to join us today. Thank you for leading and sponsoring the resolution to declare racism a public health crisis. Thank you for all that you do, and we look forward to partnering with you in your office to make the change that Dr. King and Dr. Haidt intended for us to make. Thank you so much.
Thank you so much.
It is absolutely. Have a great day. It is now my privilege to introduce Representative Judy Chu, Chair of the Congressional Asian Pacific American Caucus. I first met and saw the Congresswoman at one of the briefings, and I stood in awe of her brilliance, her honesty, and just her commitment. She is the first Chinese American woman to be elected to Congress. The first Chinese American woman to be elected to Congress. She serves on the House Ways and Means Committee and is on the Ways and Means Health Subcommittee. She's been a champion of the rights for women. She's been a champion for the COVID crisis recovery. She continues to advocate for women and girls of color. She continues to center the work of nonprofit organizations serving the most marginalized communities. And we are so happy that the Congresswoman could be here with us today. She's an inspiration to all, and her leadership allows us to stand and sit here today to have this discussion and to also seek resolution. Congresswoman, the floor is yours.
Hello, I'm Congressmember Judy Chu from Pasadena, California. As chair of the Congressional Asian Pacific American Caucus, or what we call CAPAC, I'm so honored to be part of such an important conversation, and I especially want to thank the YWCA for organizing this event. Conversations like this are essential for understanding how we can work together to advance racial justice, and this year's topic of addressing racism as a public health crisis could not be more timely as communities of color continue to be disproportionately impacted by health and economic disparities that have been exacerbated by the COVID-19 pandemic and by racial inequities ranging from police brutality to anti-Asian hate crimes. Last month, our nation was shocked and horrified by the murder of 8 people in Georgia, including 6 Asian women. In response, I organized a congressional delegation to Atlanta to be with the AAPI community during this difficult time and to meet with the victims' families. And we went there with a purpose, to follow the murderer's steps to show how deliberate he was in targeting 3 Asian-owned spas. Starting at the site of the first shooting, named Young's Asian Massage, we then drove 27 miles, as a shooter did, until we arrived at 2 more Asian spas that were next to each other, where he continued his murderous spree. Local sheriffs have tried to diminish these crimes by saying the shooter had a sex addiction and a bad day. But he had plenty of other places to go in those 27 miles. Instead, he chose 3 places where there would be no doubt that Asian women would be killed, and there is no doubt in my mind that these shootings were a hate crime. And I've written a letter to the Department of Justice urging them to investigate it as such. Nothing could be more deliberate and intentional. The shooter's actions shouted hate when he targeted these locations. But sadly, this was not an isolated incident. Since the start of the coronavirus pandemic, there have been over 3,800 reported anti-Asian hate crimes and incidents, over 2/3 of which targeted women. They were fueled by Donald Trump's usage of the terms China virus, Wuhan virus, and Kung flu, fanning the flames of xenophobia and directing anger and blame at Asian Americans. And these attacks have gotten worse over the course of the pandemic, with increasingly violent assaults, some fatal, targeting older and more vulnerable Asian Americans. In fact, these anti-Asian hate crimes have become almost a daily tragedy, leaving many Asian Americans wondering, will I be next? This is why we in KPAC have been taking action all year with press conferences, statements, letters, and legislation. And fortunately, we have already gotten help from an important partner, President Biden. Within his first week in office, President Biden issued a presidential memorandum to address anti-Asian hate that instructs the Department of Justice to work with the AAPI community in finding solutions to combating anti-Asian hate and bias. And just last week, the president invited me and other AAPI members to join him in the Oval Office to discuss additional actions that he's taking to address anti-Asian hate and keep our communities safe. He showed us just how seriously he is taking this problem. But we also need to do more to stop hate crimes from a legislative standpoint. Our laws are clearly not suited to this moment. That is why we in KPAC are urging the passage of the COVID-19 Hate Crimes Act and the No Hate Act. These 2 bills will help provide more resources and support needed to track and respond to hate crimes and to keep our communities safe. And I'm thrilled to announce that earlier this week, both bills were marked up in the House Judiciary Committee, bringing us one step closer to signing them into law. And I want to thank the YWCA for urging support of these bills. There are many steps we can take, but let me tell you what the most powerful one is. It is to come together, no matter our backgrounds, united in speaking out against hate targeting any community and addressing systemic racism in our nation. And that is why today's discussion means so much to me. We cannot do this alone. Together, let's stop Asian hate and all hate.
Thank you so much, Representative Chu. I agree with you wholeheartedly. Our differences and our diversity should make us stronger. It should not divide us. So we are here together. We continue to be in community with each other, and we are driving towards the change that you referenced. Thank you for moving the initiatives through the House, and we look forward to your partnership, your continued partnership, and we look forward to locking arms with you as we move these issues forward and we seek resolutions and move beyond the reckoning. It is now my distinct pleasure to introduce Dr. Leon Wen, our moderator for today. Dr. Wen is a physician, a public health professor, and the former health commissioner for the city of Baltimore. Dr. Wen also is a CNN contributor And she is one of the folks that got us through the last year as we dealt with the COVID virus, with her insights, her do's and don'ts, her cautionary tales and notes, and also her medical and very, very, very important information that she shared with us to help keep our community safe, to help keep our communities together, and to help us move forward as we try to overcome everything that this pandemic has done to us and our communities. Dr. Wen will guide today's discussion. She will help us explore the connections between racism and public health outcomes. She will be joined by an amazing panel that she will introduce. And I want to thank her wholeheartedly for answering the call to be here with us. Thank her for showing up in the early mornings and the late nights on television to make sure that we have access to the information that we so often don't have access to. Dr. Wen, thank you so much. You are a hero in this moment and beyond. I know that many, many, many years ago, when you were out declaring racism as a public health crisis, I know that there were many folks that did not want to hear it. But we're here now, and we're going to move forward together. And I want to thank you for trailblazing on behalf of all of the women that we serve. Thank you, Dr. Wen, and the floor is yours.
Thank you very much to Alicia for your leadership, for convening this critical conversation about addressing racism as a public health crisis and providing the space for this important topic. I also want to thank your team. Thank Vice President Catherine Bean, the YWCA team. Of course, thanks to Senator Brown and Congresswoman Chu also for their remarks. I am honored to be moderating this esteemed panel, and I'd like to introduce each person now by their very brief bio and affiliation. Their full bios are available at act.standagainstracism.org. And so I am really honored to be joined today by Margaret Mitchell, President and CEO of YWCA of Greater Cleveland, Dr. Regina Davis Moss, the Associate Executive Director of the American Public Health Association, Faith Crittenden, incoming pediatric resident at Yale New Haven Health, Nicole Austin Hillary, Executive Director of U.S. Programs at Human Rights Watch, and Sung Young Choi Moro, the Executive Director of National Asian Pacific American Women's Forum. Now, I'm going to come in time to all of our panelists, and today I wanted to explore 4 themes: defining racism as a public health crisis and what it means. We want to talk about the history and legacy of racism in America, then take a look at recent events and how that has shaped our dialogue. And then I think most importantly, to the points that Alicia and Senator Brown and Congressman Chu raised earlier, the idea of looking forward about what now needs to be done from this lens of public health. I'll address some of questions to each of the panelists on all 4 of these topics, and then also look forward to the audience conversation. So feel free to enter your comments into the live stream at any time, and I hope that we can get to as many of them as we can. Now, just to frame the conversation, you already heard about how COVID-19 has unveiled many of these existing disparities. And something that we in public health know is that the virus, in this case, the virus that causes COVID-19 is not the one doing the discriminating. That it's the systems that we have in place that's amplifying these existing disparities. Alicia wrote, she alluded to the point about how back, it was a while ago, I think that all of us on this panel have been thinking about and talking about racism as a public health crisis. And actually back in 2015, after the death of Freddie Gray while in police custody here in Baltimore, my health department at that time talked about racism as a public health issue. And I have to tell you that the remarks that we got, a lot of people were frankly very puzzled because I don't think they had heard that kind of framing before. And we had to backtrack into this. People were like, well, what does it mean racism is a public health issue? We had to talk about how racial disparities are a public health issue. poverty is a public health issue, violence is a public health issue. So now let's talk about racism itself as a public health issue and public health crisis. So it is high time for us to address this issue. I am really excited to be moderating this panel. And I now want to go on to the first part of this, which is what it means to define racism as a public health crisis. By first turning to Dr. Davis Moss. And I start with you, Regina, because the American Public Health Association has been a real leader in the movement. So can you help us to frame the conversation, and at a basic definitional level, what does it mean for racism to be a public health crisis? How does it change things if we view racism through the lens of public health?
Great. Thanks so much for that question. And I want to thank you all for inviting me. So before I do that, let me just start by saying what racism is. And we've talked about this a little bit, but it's very important that we understand racism is a social construct. It is a system that assigns value and hierarchy based on the interpretation of the color of one's skin. It is not biological. Okay, we've mapped the DNA, the entire genome, DNA, and we know that in fact we're probably more alike than we are different. So when we understand that, then we can get into understanding how there's an intersection between racism and health. So when most people think about this, we think about interpersonal racism when those are those sort of overt acts of prejudice or bias. And that might be something like, well, you didn't receive an important medical treatment or life-saving medical treatment because of the color of your skin. But that's not what we're talking about when we're talking about racism as a public health issue. We're really focusing on the community. So we're talking about those larger, ongoing structural and institutional forces that shape inequality in our society. So things like redlining. When you can't get insurance or you can't get financial services because of the color of your skin, that is racism. When there's underinvestment in schools, when it's precarious about whether or not you'll have employment, we have scarce access to quality health care. These are what we call the social determinants of health, and these are root causes for why people of color have poorer health outcomes. So when we're talking about it in that context and we look at it from a public health lens, anytime we identify something as an emergency, a crisis, or a threat, it's because it affects large numbers of people, because it's threatened all aspects of health over a long term, and because it requires a large-scale adoption in order to solve the issue. And so, fortunately, we have seen a lot of attention on this issue. We've seen it particularly with regard to the declarations. In fact, APHA has been tracking these declarations, and to date, there have been over 194 in states, cities, counties, and boards.
That's wonderful. Thank you very much for giving us that overview. I want to turn to Margaret, because Margaret, you have been a superb champion on this issue in Cleveland and in working with YWCAs in Ohio to persuade mayors, county councils, and even the state legislature to declare and address racism as a public health crisis. And I am so curious about what inspired you to take on this advocacy, and what barriers have you encountered?
Well, I have to tell you, we were so inspired by work that has been done in Seattle. We were inspired by the work that was done in Milwaukee, specifically around the declaration of racism in May of 2019. And we were preparing to host a conference here with our partner, First Year Cleveland, to commemorate 400 years of inequities from 1619 to 2019. And we wanted there to be a call to action. And we knew, because of the advocacy happening both in Seattle and other communities, but certainly in Milwaukee, that declaring racism a public health crisis was an important step. And, you know, our mission, the mission of the YWCA, is eliminating racism. And we believe that this is possible in our lifetime, that racism can become rare and brief, that we can see it, identify it, and root it out. But we must begin by boldly making a declaration and claiming our agency.
Can I ask you also about the ways that racism affects public health outcomes? And specifically, are there things that the legislators, those that you spoke to, anything that jogged their mind, as in when you said, that's racism as it relates to public health, they said, oh, I hadn't really thought about that?
You know, when we first started working on this issue, as you alluded to, Dr. Nguyen, people, in 2019, it was really difficult for them to connect public health and racism together. But when you start walking through disparities, as Dr. Davis Moss so eloquently just walked us through, you begin to understand that disparities are literally the measure of racism itself. And so, I think we just began to go to work on this issue.
That's such a great way of framing it. And I so appreciated the way that both you and Dr. Davis Moss tied in the social determinants, because we in public health live them, but perhaps not everyone understands how everything is related in a sense to health. Faith, I'd like to bring you into the conversation. I was so impressed to learn that while still in medical school, you and your colleagues helped to push the American Medical Association, the AMA, to declare racism a public health issue. Can you share with us why this was so important to you and your colleagues, and how does it then change the medical profession's approach?
Absolutely. First, I want to recognize my other co-authors on this policy, Rohan Kajanchi and Anna Heffron, who came to me, as well as the other medical students and the trainees and attendings who created the Anti-Racism Coalition that allowed us to get this passed. In order with addressing the policy, when we first wanted to do it, it wasn't something that we were looking for to something to make history as. We realized it was just something that was way overdue. We were looking at the research. We saw there was just decades and decades of work done by researchers connecting that health disparities and the racism were related. We just realized that organizations needed to start talking about it. We wanted to say, knock on the door and say, hey, it's time for us to address this as an issue and going forward. And who better than the medical students who are learning now about medicine to address this?
I think part of the reason why I thought this was really incredible is medicine is traditionally understood as a conservative profession. And so if I may stick with you for a moment, Faith, and just ask you how you did this. I mean, who did you approach? How did you go about maneuvering internally? And what are the lessons that we can all draw in our advocacy?
Absolutely. One thing about I love being a part of the AMA, especially the medical student section, is a lot of people call us the soul and the moral aspect of the AMA, because we really do challenge them to start looking at things beyond what we're seeing currently. So at times medicine can seem conservative, but the medical student sees things from different perspectives. And that was one of the reasons why we were able to kind of bring this forward through our medical student section. Now, just because we're medical students, and we're seeing things through a different lens does not mean it's easy to pass a policy. At the time that we did pass this through the medical student section, we needed about 50 citations to prove to other medical students that this was an issue. By the time that we got to the level of attendings and fellows and trainees, we had over about 100 citations, and all of them were from people of color, over decades and decades of research proving this.
I love that. It's a combination of data, grassroots activism, and people working together to get there. Thank you for that reminder. I want to move on to our second section, talking about the history and legacy of racism in America. And we included this here because any conversation about racial justice needs to be understood within the broader context of America's history of systemic and structural racism. Because so much of what we've seen in the past several weeks and months, it's not new in a sense. It's actually an escalation of racism. And that's true regardless of whether we're talking about the mass shooting in Atlanta that left 8 people dead, including 6 Asian American women, or the guilty verdict in the murder of George Floyd, or the continued racial disparities in health outcomes for people of color who have become disproportionately affected during COVID-19. So, Nicole, I'd like to ask you to share with us your perspective on what we need to know from our history to fully understand this moment we're in America.
Thank you so much, Dr. Wen. And let me say that I think the panel that has been brought together here today just really underscores the importance of the topic that we are taking on, racism as a health issue, because it takes a village. It's not just a medical issue. It requires the doctors, the lawyers, the activists, the advocates, the lawmakers. It takes that huge collaborative effort to really address this issue. And that ties into the question that you asked me also, which is, what is the history of this? 400 plus years ago, the first African slaves were brought to this country. And they were not brought to this country with the full promise of citizenship and rights. They were brought to this country as chattel, to do work, to be part of the economic engine of the United States. And you have to understand that foundational issue and history in order to understand all of the pieces that have brought us to this point today. Systemic racism, when we talk about it, is the best way to explain it. If you take a group of people for whom their original intention and purpose was not meant for them to serve as citizens who could take part in the full promise of the United States and its democracy, then you understand that what we have been fighting against for 400 plus years is trying to ensure the promise of America, trying to ensure the promise of America for people that were never intended to receive that promise. So all of the systems that we all take part in, that we all engage in every day, whether we're talking about our healthcare systems, our housing systems, our educational systems, our legal systems, all of those were systems that were created with the understanding that those original slaves and their descendants were not meant to be a part of this country. And so we've been fighting for all of these years to make those promises true. And that's why we see the health disparities that we're talking about today show up in so many different venues. You know, some of the work that we do at Human Rights Watch, just as a quick example, is focused on water rights. We work with coalitional partners around the country, and in particular, we have focused on what's happening in the Detroit area and how research was done by community partners there that showed a correlation between water shutoffs, because people couldn't afford to pay their water bills, and the rise in COVID-19 cases. That's what we mean when we talk about systemic racism. That's what we mean when we talk about health disparities. If you don't have clean water, if you don't have access to clean water to take care of yourselves and take care of your families, that's going to have a huge impact on your health. And the economic impact that we saw take place during COVID is that communities of color, Black communities, poor communities, were the ones who were most likely to have their water shut off. Again, that is because we have systems in place where those communities have not had equal access to care, have not had equal access to the jobs that allow them to pay the bills, that allow them to keep the water on. So connecting those dots, Dr. Wen, is vitally important to us understanding what we're dealing with today and then how we land on the right solutions.
I so appreciate the way that you framed this, Nicole, because of what you said about connecting the dots. I think so often we look at things as individual issues, things impacting the individual patient. In my case, I always talk about patients, but actually there are systemic issues that we need to be aware of. And you just, I think, tied it together so beautifully about why we need to be aware of the history as it relates to the present conditions that so many people face too. I want to turn now to Sung Young. In preparing for today, you shared with us that there's a really unknown, or at least not talked about, history of racism against the AAPI community that's foundational to understanding what's happening today in the midst of the COVID-19 crisis. And so what do people need to know and understand about racism against Asian Americans and Pacific Islanders in the U.S.?
Thank you for that question, Dr. Wen. As Dr. Wen alluded to, being scapegoated and being discriminated against is nothing new for the Asian American community. It's just at a heightened level where so many people are paying attention because of the level of violence that we're experiencing. And so, while the Atlanta shootings happened in the midst of all that's going on with coronavirus, that also has a very unique history of intersectionality of race and gender that played out in the motivations of that killer that we need to talk about as well. The history of how Asian American women especially have been treated in the United States, starting from 1875, the passage of the Page Act, which essentially banned Asian women from coming to the United States. This was during the time when many Chinese folks were coming to build the railroads on the West Coast. And so, of course, when you have workers migrating, you have families coming along. You have moms, you have daughters, you have sisters. And we were viewed to be sex workers, prostitutes, and it's actually written in the law itself that the reason we're being banned is because we are seen to come here to prostitute. That is how we have been viewed since day one in this country. And, that's very much in line with my daily experience, maybe not daily, but current occurrence, right? When I walk around the streets, I get these racialized sexual harassment directed at me. And what you see happening post-Atlanta shooting is this groundswell of Asian American women speaking up, saying, I can relate to that incident, and it's scary because I have been there and understand the motivation of that killer, right? And so that's, specifically around the shooting that happened in Atlanta. But if you look at even before that, NAPOF has been advocating, saying, as this pandemic gets worse, back in March, when our former president started calling it the Kung flu and the China virus and all of this, we were very concerned that as this gets worse and more people are getting sick, more people are dying, and more people are without jobs and losing their homes, that the country was going to look for a scapegoat. And that's exactly what's happening right now, right? The escalation of violence that's directed at Asian Americans because of misinformation, it is dangerous, right? It is a detriment to our health. And again, this isn't new, right? There's the Chinese Exclusion Act. The term yellow peril was created to otherize and alienate Asian Americans, right? It is the government's propaganda that created these terms such as, stay away from the Chinese because they eat rats and cats. These type of things that people just throw around to make fun of our children was intentionally propagated by the government to other our community and continue to perpetuate that we are always foreigners, right? That I have friends who are 6th, 7th generation Japanese American, Chinese American, who are still to this day asked, where are you really from, right? It is ingrained in our society that if you look like me, you cannot possibly be from here, right? And this is why we need to include Asian American history and the racist laws that have impacted our communities throughout time. Chinese Exclusion Act, the Japanese internment that the Japanese American community experienced during World War II, the surveillance of the South Asian community post 9/11. I mean, our community has experienced systemic discrimination in this country and nobody talks about it. And so, when we come to this pandemic, people are surprised. I mean, the number of people who have said to me, I had no idea you were experiencing these kinds of discriminations has been pretty shocking to me, right? So I think it's really important that we include our story as part of the American story so that we're not surprised. These things are going to continue to happen. We hope that we end racism, as it is the mission of YWCA, someday. But while we're still in the fight, we want to be recognized as part of a community that is fighting the struggle together because we're also impacted by racism.
Wow. Thank you so much for your courage in sharing a lot that I can very much relate to as an Asian American person as well. You also segued very beautifully into the looking at recent events, how our history ties to recent events, the third part of our section. And I want to talk about COVID-19 for a moment, because that certainly is one of the recent events that we are living through. And so turning to Dr. Davis-Moss, from a public health perspective, can you tell us a bit more about how COVID-19 and the pandemic has highlighted racism as a public health crisis and what you think needs to be done in moving forward?
Sure. So when we talk about people being able to realize their full health, that means that they have the resources and the opportunity and the information to not just have great physical health, but mental and social well-being. And so what COVID did was really just illuminate what we have always known, that certain communities don't have access to that. And so what we saw was when there were not things, for example, like testing, or even now when we don't see as many vaccine sites in the communities that are hardest hit, or you don't see primary care in those communities like we see it in the others, those are examples of the systemic racism that we're talking about. And I want to be clear because, we can get caught up in this notion of, well, that's not intentional. Whether it is or it's not, it exists and it's institutional and it's ongoing. And so those are the things that we're talking about when we say that COVID has really illuminated for a lot of people to see. And it was because of the way that it was structured that a lot of people got the opportunity to experience that, not just communities of color. So what we're doing now is what we've always done is we're mobilizing, we're tracking, we're trying to do our best to get into the communities, to help people become healthy, to provide the services. And we're also, fortunately, with the help of our legislators, who are now understanding that allowing communities to continue like this has the potential for tremendous harm for everyone, and understanding that it's an urgency that we address this. They're assigning funding for these types of things. They're analyzing data in a lot of ways. So we're hopeful in that we can continue to dismantle these problematic institutions so that we can advance good health.
Thank you for that, and I appreciate the very forward-looking approach to this issue. Nicole, I want to ask you also about how the protests and social unrest and uprisings during the past year in response to the killings of George Floyd, Breonna Taylor, and other Black and brown people by police officers, how that has contributed to the momentum, too, of addressing racism as a public health crisis.
It's contributed in that it has opened so many eyes and ears and has really expanded the numbers of people who have a better understanding of this issue. When you talked earlier, Dr. Wen, about the earlier days of first discussing this concept of racism as a health issue, you said so many people said, well, what is this? Can you put this in some context? We have seen after the killing of George Floyd and the death of Breonna Taylor and so many others, for whom the list is way too long, that not only in the United States, but the world has awakened. It has served as a catalyst for everyone to take a closer look at the issues that have brought us to this point. And what people are understanding is that while the loss of life, as atrocious as it is, was the starting point, that it really involves so much more. It really involves understanding how communities have thrived, how certain communities and people have been discarded, misunderstood, have received disparate treatment. And what it's also helped us to understand is that even when you control for everything else, when you control for education, when you control for income, that what we are still left with is the issue of race. Because when we talk about some of these health disparities that we all work on, it doesn't matter if you perhaps are a person of color, a Black person, for instance, who has a better education or who has a better job, you still are suffering the consequences brought about by racism. For instance, when we talk about maternal health deaths, even well-educated Black women are suffering at disproportionate rates from maternal health deaths. Some of the work we've done around cervical cancer has shown that women in the South, for instance, where we've done research in Alabama, Black women are suffering at disproportionate rates around the issue of cervical cancer. And it doesn't matter what your educational level is, what your wealth level is. So this moment of protest has helped us all to see that we have to look at all of these various issues and understand, again, Dr. Wen, the interconnectedness of these issues, and that we can't look at them in silos. We can't simply say, well, let's look at what's going on in housing, or let's look at what's going on in policing. All of these issues have a connection, and we have to understand what that connection is so that we realize that economic inequities are also related to health inequities, are also related to racial inequities. That's what this moment has brought us to. And at this point, it's, as you say, you cannot put the jack back in the box. It's out, and we all have this understanding, and now we can build from this mutual understanding.
Thank you for that. And if I may go back to Sung Young for a moment, because you had already talked about how this moment of anti-Asian rhetoric, hate, and violence certainly contributes to a direct potential physical harm to people. But I wonder if you can also share with us some of NAPAWF's new polling data about public health implications, including about mental health, and how that then fits into this idea of racism as a public health crisis.
Sure thing. So NAPAWF conducted a polling of Asian American women who voted in the presidential election just this last year. And a staggering 75% of the respondents said they are dealing with some kind of mental health issue because of the pandemic. 50% of the respondents responded that they have experienced some kind of public harassment in the last 24 months. Obviously, these play very much into people's mental health and anxiety and those issues when you think about one's safety and being able to be outside. And I mean, literally, I know very few Asian American women who are going on walks or doing their, routine exercises outside alone anymore, right? Many of us are telling our parents to not go outside on their own or even together, to not go outside without a younger person accompanying them, right? I mean, this is the state that our community is in right now. And so you can imagine the mental health impact of that, like my parents, they like to go on a walk every morning, just fresh air. That's just what they do. They get their blood flowing. The fact that they're dependent on me to be available to go with them, or, somebody else in my household to be available to go with them, is a huge mental health issue, right? That their dependency on someone, especially for elderly, right? These all contribute to what's going on. The other thing that I want to say is, at the beginning of the pandemic, one of the toughest things for our community was the fact that, as you know, this is a public health crisis, and we were not dealing with the pandemic like it was a public health crisis. There wasn't clear guidance around who was going to cover the cost of a COVID test. I personally know Koreans who don't have health insurance who didn't go get tested at the beginning, even though they thought they were exposed, because they didn't know what kind of bill they would be stuck with if they went and got tested. Right? People are afraid to go to the doctor because they're afraid that they're going to be hospitalized and they're going to be stuck with a big bill. And so, you have people walking around who, and I'm sure not just Koreans, other people too, who were afraid of getting tested because there wasn't a clear understanding and universal access to tests at the beginning of the pandemic, as well as other resources. Many of our community members have not been able to access COVID benefits, whether it's unemployment insurance or assistance for mortgages and utilities, all of these things, because most of these programs are rolled out only in English and maybe in Spanish. Many of our community members don't have access to those languages. And in fact, I myself have personally volunteered for a hotline to help some of our Korean community members fill out forms so they can get, support during these difficult times. And many small businesses have definitely been left out of any kind of relief programs, again, because of language access. I know very few Asian American run businesses that actually got a PPP loan because it was very difficult to navigate and understand because of language access. And so these are ways that are playing out and creating more disparities in our community when it comes to dealing with the pandemic and as a public health crisis.
Thank you for highlighting that. And I'm actually reminded of so many of the conversations we have around vaccines, that people, when they look at disproportionate rates of uptake of vaccines among communities of color, the initial thought is, it must be about hesitancy. But we must also think about issues of access. And sometimes I think there is so often a tendency to go towards hesitancy because it seems like it's a choice that somebody is making rather than what are the systemic barriers in place. And that recognizing that choice is really predicated on privilege. So I want to move on to our fourth section, which I think is the most exciting in a sense, is the looking forward, what must be done. A reminder that we're going to go to audience questions after this. And so I hope that you will be entering your questions into the live stream. Although I'm sure that I will also have a lot of questions for our panelists if we don't get enough questions. But I wanted to turn to Margaret. And you talked before, Margaret, about the work that local communities in Ohio have already been doing to declare racism as a public health crisis. After the declaration, what do you want to see? What are the types of outcomes that you would want to see coming out? And are there already any kind of positive outcomes for people of color that we can see?
You know, I really want to see a sustained effort. I hope this is an approach that is going to be so important for us. This is not a short-term fix. We must look at this work as an approach that we sustain over the next 50 years, the next 100 years, the next 150 years, because it is so important for us to continue to eradicate racism wherever it exists. And I think that in the declaration, we begin to understand that we must pivot in a way to look at the budgets of municipalities and cities and understand how it must align to do the work. And one of the most important pieces is really understanding that the psyche of America has changed. And so, the psyche, the collective psyche before was that there's something wrong with the people, that there is something wrong with these women of color, Black and brown and Asian and indigenous women. And we now begin to see that the pivot is looking at the structures, looking at the policies, looking at the practices. And that is such a huge swing of the pendulum. But we must stay there. This is not a time for us to begin to look away, to feel that we have achieved something. We must sustain this effort. And I think, one of the things that we are seeing are collectives, are organizations and communities that are building coalitions of consciousness and coming together to work with cities and counties to begin to do this work. It is a very exciting time, but we must continue this work collectively.
Thank you for that, Margaret. Faith, if I may come to you, you had talked before about how important it is for students to be driving the work and pushing, and the medical profession, it seems like, is changing. What more do you want to see the medical profession do differently moving forward?
I think when it comes to addressing things like racism and health is understanding that we have to consider it a value, that we have to put it at the forefront when we're talking about evidence-based medicine, when we're talking about things that are the core concepts of our profession. Racism has to be there. Well, the work for anti-racism has to be there. And I think that's some things that we are seeing now, especially with the AMA's Health Equity Center led by Dr. Althea Maybank has done just remarkable work in making sure that they're addressing anti-racism. Recently, they just released a paper kind of talking about the major journals and how they are not talking about racism. And they've looked over at 200 articles that they have published over the past 30 years, and less than 1% of them have ever mentioned the word racism. And right there, that's an issue that we can address right then and there, as well as medical students now re-examining medical education. I know right now there are some medical students within the AMA looking at how we can readdress the effects of the Flexner report and trying to make sure that in our accreditation that we're now asking for more anti-racism work, that medical students, regardless of where you are going to medical school in the country, are now required to learn the effects of racism on health. We're required to learn the history of how the medical organizations, institutions have affected others' health and how racism has played a part in that. And that's the only ways I think we can move forward.
I really like that. And you referenced the Flexner report and accreditation. I mean, I feel like as a medical person, I resonate with that and say, yes, these are the opportunities for structural change, right? I mean, these are really technical things that people in the medical profession care about, but you have to look for the levers of change wherever it is that you can. Regina, Dr. Davis-Moss, if I may turn to you, I've been meaning to ask about this because, and actually we had a audience question about this too. And by the way, a reminder for everyone, you can still submit your questions via the live stream. I wanted to ask you this too, but one of the audience members wanted to ask about what does it mean for the CDC, the Centers for Disease Control and Prevention, to recognize racism as a serious public health threat that directly affects the well-being of millions of Americans. That's literally what the CDC has said. What does that mean? Is it important? What do you want to see from that kind of declaration?
Number one, it's tremendous because we know the CDC is the lead agency for our public health response. So when the CDC is going on record as saying, we recognize that this is a crisis, then we can follow suit with that. And as I talked about, we're now beyond all these declarations. We're now at the point where we are looking at action. So that action can be a number of things. It can be funding for programs. So we have to acknowledge that public health is not new to the space of addressing these things, right? So we've had longstanding programs to address health disparities, but we can have additional programming related to funding to conduct research on things like violent deaths, or the connection between housing and health, the connection between high school graduation. All of those things, as we look at them, are determinants of health. And, I think that I would love to see other agencies follow suit, not just with the CDC, all of the leading agencies in declaring this as a crisis for their sectors. And love to continue to see whether that be accountability with data, all the things that we need to do a thorough public health response.
And that thorough public health response absolutely takes into account the social determinants of health and how everything that we're talking about is linked to one another. And in a sense, that's what makes public health challenging and important, but that's also why we're having this conversation. There is a question that I want to direct to Nicole, if I may. There's a question about how do you approach people who disagree, in fact, with our entire conversation. I mean, there are people who are going to say, well, maybe disparities are a health issue, but I don't know about addressing racism as a public health crisis. How do you address comments like that? What's your advice for the audience who may be speaking to people who are not already inclined to think as those of us on the panel do?
That's such a great question. And it's come up so many times throughout the course of this last year. And I go back to something that I've shared in many discussions over the past several months, which is this, that we have to just keep talking to one another. It's okay if you come to the table and you have disagreement, but we have to do two things. And the first thing is that we have to listen. We don't listen enough to one another so that we can gain an understanding of what someone else's views might be. And then we have to talk, share information that we have. Information is powerful, as we all know. This panel is filled with people who work with data, who work with research. And we know that data and research undergirds the work that we do. Being able to point people to information and to share information that they can weigh and judge for themselves is extremely helpful. But the other thing that we have to do is we have to enable and to create spaces for people to have these conversations. There's not enough of that that's been happening. And that's why we continue to be in silos in terms of how we think. There's no cross-pollination between people who are talking to one another. For those of you who, like me, are 60 Minutes junkies, there was a story a few weeks ago done by 60 Minutes and CBS News that brought together people who were from completely polar opposite ends of the political spectrum. And some of these people traveled near and far, COVID safe, Dr. Wen, wearing masks and socially distant, and were brought together in a space where they were just talking about their different views on certain political issues. And what some of them said at the end of that conversation was, I just never had an opportunity to be in a room across from someone who thought differently from me, but who was open to hearing me out and to whom I could also express a level of openness. I think that's where we have to start these conversations and then arm ourselves with data and information that can be shared. And don't share it in a judgmental way. Share it in a way to say, here's something I think you should consider. And then we allow people to make determinations for themselves. That has to be at the root of how we all start working collectively to address some of these issues. We have to listen and talk to them.
Dr. Wen, can I just speak briefly to that data point? So let me just say that the science is clear on this. So some people take a reductionist approach, we can go back to the Heckler report, which is decades old, but we have looked at the biological basis and studied it from telomere lengths to measured different hormones. We've also measured things like the reproductive aging in some populations versus others. And it's very clear that there's a biological basis to this work, that is not just a theoretical feeling.
Thank you very much. And I think, again, we're having so many questions come through. I'm going to try to get to as many as we can. But one question, and actually I'm going to combine two of our viewer questions into one, if you don't mind, and direct it to Sung-Young. The question is about, is a passing declaration enough? How do we hold organizations and leaders accountable? And actually somebody else had a question about any thoughts about school courses that there might be on the history of anti-immigrant sentiment. And I just wonder if you could address both of those components, if you don't mind.
Sure thing. Make it quick so we can get through more questions. That's a great approach. I like that. So to the issue, the question about declarations, I mean, we all know, like there's laws and declarations and resolutions passed every year in and out. And it's really about what we do with that. That, to me, that's a starting point, right? If that's the end and the goal, then we have lost. And then I think that's often the problem, is that we put all our energy into getting words on paper. And then it's like, oh, great, we're done. And really, the lives of people have not changed much just because there were words on paper that, somebody, now I guess on computer, but whatever. But I think it's powerful that CDC has declared racism as a public health issue. And it's about, what do we do with that information? What do we do with that in our advocacy and our ongoing research and work that can really make the difference? And so I know that, personally for me and the work we do at NAPOF, we are constantly paying attention to these things that come out of government agency, because we use that in our conversations with staff at the White House, right? Because we can say, your folks are saying this, and so we need you to now put some money into it to make this work, right? And so it's helpful. It's helpful to have that, but that alone can't be enough. And so we need to, it's same as electing folks who promise you the world. Like, that's not the end of it. You've got to keep them accountable, right? And so continuing to, do advocacy and visits and communicating with your elected officials and the people who have the power to make these decisions is really crucial in our long-term success, right? To continue to keep the pressure on and to make sure that we're moving to the next level. Okay, great. Now we have it in writing. Okay, this is the next level that we need to work on. And I think that's really the way we go about it. To the question about including history. So one of the things that NAPOF was proud to support, and I can't remember the exact name of the bill, but Representative Grace Meng of New York actually introduced a bill to require K through 12 education curriculums to include Asian American history. And I think that's really important. It's a great start, and there are lots of resources we can use. But as a public school parent myself, I know it's most impactful at the local level. I was, in fact, just telling somebody that my board of education has seen me more than probably any other kindergarten mom this past year, as I've been very vocal about advocating for what my daughter and what our community needs during this time of COVID and virtual schooling, right? And so don't wait for a law to make your school required to do this. You can advocate for yourselves, and as a parent or as a member of the community, there are resources available for you online. There are organizations that are championing bills that, at local levels to pass inclusion of Asian American studies. But also, Asian Pacific American Heritage Month is coming up in May. It's a great opportunity to just call your principal, call the school the district superintendent, or your teacher, your child's teacher, and to say, hey, this month is coming up. It's a great starting point to have conversations. Don't let that be the end of it, but that's a great hook to get into talking about how to include that in education.
Thank you for that very comprehensive answer. And I think it's a great segue into the final part of our discussion, which is a call to action. And I want to turn to each of you to give your closing remarks about the specific actions that you would suggest for people listening to this town hall discussion who want to now do something about addressing racism as a public health crisis. And I want to get to all 5 of our panelists in the order that I first introduced them. And so beginning with Margaret, then Dr. Davis Moss, then Faith, then Nicole, then finally Sun Young. So Margaret, if you would begin, and then all the panelists, please follow on the person who is before you, please.
I think there's an incredibly important opportunity with Senator Brown's legislation to have movement at the federal level, and we cannot forget that. And it's so important for us to move in that direction. This panel, this time together, this is the work of the YWCA. We live at the intersection of women and racism, and so I think it's so important to be plugged in and connected to the community. Education is such a powerful place for everybody to lean in. The dominant culture owns the narrative on education. And until we all are able to make sure that we are accurately telling the truth of history, we're not going to be able to move the needle at all. There are declarations, I think the number was 194 across the country, and there are still opportunities to move in with city and county officials to make that declaration. But there is opportunity to have your voice heard, and engagement of your voice is critically important. This is what democracy is about. And so wherever you are passionate about, that is where you should step into this work.
Yeah, and I'll follow with that. I mean, I love that, but I would just say that, the declarations are a great first step because they're for the first time acknowledging that racism exists. But it's also that we are saying that there's these systems and these structures that are causing the inequities, and it's not the fault of an individual. And so what I would say is continue to work in your communities to make these declarations. APHA has tools and resources available to you if you're interested. And let's hold the governments accountable for making meaningful progress so that people of color can live this life that they deserve to live.
Yeah, I strongly agree. I think especially as a medical professional, one of the ways that we can definitely get this across is making sure that we address racism in all aspects, whether, especially with race not being biology, that's something that we did pass, as well as race-based medicine and combating that when it comes not only to nephrology, but also in pulmonology and so many other fields, and as well as making sure that we educate medical students and medical professionals at large of the history of the professions that they are in. A lot of us are graduating and don't even understand the history and why we are practicing the way we are practicing. And even at the local level, understanding the communities you serve, understanding why they eat at particular places, why they worship at particular places, really understanding your patients is a way that we can combat this.
I'm going to leave our audience with 3 calls to action. Number one, policy. Urge your lawmakers at every level, from federal on down to state, on down to your local legislators, to include recommendations and mechanisms that deal directly with these issues we've been talking about today. Representative Underwood, for instance, in the US Congress, has a package of bills right now that will seek to deal with issues that impact maternal health. We should be asking all of our legislators who represent us to think about these issues regularly and daily, and to make them a part of the legislative pieces that they are putting in place. We are not going to see change if the lawmakers don't insist upon it. That's number one. Number two, we have to start talking about reparative justice. Reparative justice means making people who have been discriminated against, who've been discarded, who've been forgotten, and who have lost because of racist policies historically. What do we need to do to make those individuals in their communities whole? There is a bill right now in Congress, H.R. 40. It is a bill that would put together a commission just to study the issue of reparations and the impact of slavery in this country. And it's not about just looking at money. It is about looking at what kinds of repairs do we need to put in place so that communities that have been discriminated against for generations around housing, around healthcare, around education, what can we do in terms of our policies and practices to make those communities whole? And then lastly, stand where you are. We are all individually what I like to call justice warriors. We can use our own personal bully pulpits to work within our own communities, within our own organizations to bring about change. Have those conversations we've been talking about. Advocate, put together campaigns in your own communities. You don't have to have a title behind your name. You just have to have the will and the heart and the organizational muster to tap the people who are right next to you to make a difference.
Just a couple things I would add to that is, one of the things I think is so important is to have policymakers that look like us and have our lived experience. It is shocking how hard it is to get intersectional policy making done. People want to talk about one thing at a time. And so I would encourage you, especially if you're a person of color or woman of color that's in this audience, think about running for office, run any level, school board, park district, whatever it is, because your experience and perspective will bring so much leadership in a way that our country really, really needs it. And then, I endorse everything everybody else said here in terms of advocating, just constantly, making the noise to make sure that we don't settle, right? Like often, the lawmakers are very busy and have a lot going on. And so, once they give you that one thing, they're like, okay, now back off, go do something else. And we have to be persistent because our lives are at stake. Our children's lives are at stake. Our communities are at stake. So, make sure and along the journey to take care of yourself because this work is difficult. It's hard. And as, Alicia mentioned at the beginning, it is very personal for many of us. And so those would be my recommendations and call to action.
That's so terrific and such a great way for us to end our conversation. I feel like we could go on for so many more hours. I would just say what I have taken away from all of this is how much the issues that we're talking about are not new. There is a term that we in medicine use about how this is something acute on chronic, that you have chronic ongoing issues, but then you have acute issues that bring them out, that exacerbate them, that escalate these existing issues. And I think we need to be mindful of our history, but then we also need to move forward. We know that public health ties to so many factors. These social determinants of health link everything together. But we also cannot wait. I think sometimes there is a sense when you say, well, health is related to everything else, racial justice is related to everything else. Sometimes you can almost feel helpless and say, well, where do I even begin in all of this? But I think I have just felt so inspired listening to our panelists talk about very concrete examples of what we can do today from the vantage point that we have, no matter who we are, no matter what stage of life we're in, no matter who we're surrounded by, what our title is, the things that we can do right now and how really, this declaration of racism as a public health crisis is so critical and so overdue, but it's also one that is a beginning. It is certainly not the end of our journey. So I want to thank once again our esteemed panelists, Margaret Mitchell, Dr. Regina Davis-Moss, Faith Crittenden, Nicole Austin Hillary, Sung Young Choi Morrow for their exceptional comments today. I want to thank Senator Brown, Representative Chu, and of course the YWCA Leadership Interim CEO Alicia Rhodes, and Vice President of Public Policy and Advocacy Catherine Bean, to whom I'm delighted to turn to for your comments.
Thank you so much, Dr. Nguyen, and thank you for leading this extraordinary conversation. It has been an absolutely amazing discussion today. And thank you, Faith, Regina, Sung Yun, Nicole, Margaret, as well as Senator Brown and Representative Chu for sharing your thoughts, your insights on this critical conversation with YWCA and everyone who's joined from around the country. As we wrap up, we at YWCA really want to invite each of you who are in our audience to continue engaging with Stand Against Racism over the next several days and with YWCA in the weeks and months ahead. And there's 3 distinct ways that you can stay engaged with us. First, you can join an event. Between now and Sunday, the YWCA network is hosting more than 90 events around the country. Most of them are virtual events. You can go to standagainstracism.org as your gateway to find the map that tells you where events are being held. You can learn about the topics and how to register for them. And we hope that you'll engage with those issues that are of particular interest to you, as well as if you live in a community where there's a YWCA event, that you can connect with those in your community through that experience. The second way you can stay engaged with us is really to take action. At standagainstracism.org, there's a button up top. It's in the top right-hand corner that says Act Now. When you click that button, you'll be taken to YWCA's Action Center, and there's 5 things you can do. First, you can take the pledge to stand against racism, and then you can take action on 4 pieces of legislation, several of which has been mentioned here today. One is the resolution to declare racism a public health crisis that Senator Brown is introducing today, and there's a companion bill in the House of Representatives, so that's one piece of legislation. Another is the George Floyd Justice in Policing Act, the Momnibus maternal health bill that I believe Nicole mentioned to us in her closing remarks, and there's a COVID-19 Hate Crimes Act. All 4 of these bills are relevant to the conversation we've had today, and we hope you will urge your senators and representatives to support this legislation. Make sure your voice is heard, because that's what matters in this democracy that we have. And then finally, our third area is please join us on social media. We want you to like this video recording. If you're on YouTube or Facebook, like it so others will see it. Follow us on Twitter and Facebook and Instagram. And also use the hashtag Stand Against Racism to tell the world why you yourself are taking a stand against racism, and to share why our issue that we've explored here today, why addressing racism as a public health crisis is so important. Thank you again for joining YWCA in this important conversation, and thank you for joining us every day as we take a stand against racism. Thank you.
We hold these truths to be self-evident, that all people are created equal and born with certain unalienable rights, including life, liberty, and the pursuit of happiness. But all too often, that truth is forgotten. All too often, those rights are ignored, as all too many stand in silence and all too many suffer alone. So our work goes on until the land of the free is free of racism, until the home of the brave is brave enough to change, until by the people and for the people means doing right by all the people, until justice just is.